Hello and welcome once again to this channel Clinic Wahala by yours truly, Dr. Catch. It's a channel we brought up to educate people, the everyday man or woman you see on the streets. It's a channel we created so that we can reach out to you and educate you as regards health and healthy practices based on our experiences in the clinics and our practice generally. We aim to bring it down to very simplified forms so that the papas, the mamas, the educated, the uneducated, everybody will grab something, learn something that they can use to better their health. So it may not be good enough for those that are using them for academic purposes. Like I said, the aim is to deliver it in the most simplified form so that everybody will pick something and make their health better. So while you are here, kindly click the like button, subscribe, and share this channel to your friends, your family, everybody around you so that they can also partake of this and live better. Thank you. Alright, so we will continue from where we stopped as regards hypertension being the silent killer. So we are going gradually. I believe the last time we stopped at the point of trying to explain what the cardiovascular system is. Yes, you can take it to be the heart and the pipes through which it pumps blood. Now the heart, the arteries, the veins, and the places they pump blood to, as well as the organs that affect the activities of these heart and blood vessels. So the heart is the main pumping center, while the blood vessels, the arteries and veins, you see them as pipes connected to the heart. The arteries are the pipes that carry blood to every organ or tissue so that they can utilize the blood. When they are done using the blood, it's taken back through the veins. The pipes will go back to the heart. The heart will carry them to the lungs, oxygenate them and all, bring it back to the heart and send it round again. So let's take this to be the cardiovascular system. So wherever you hear cardiovascular system, is referring to the heart and the pipes through which it pumps blood, as well as the things that affect other organs that affect it. So, and why we are talking about this cardiovascular system, because the cardiovascular diseases are the main cause of deaths amongst non-communicable diseases. There are diseases that infections that you need to contact before it affects you, they are communicable, but cardiovascular ones are not communicable. They just happen when this cardiovascular system is affected. So cardiovascular system, it's a major cause of cardiovascular death and a major cause of death worldwide, especially amongst middle age and elderly people. So that's people that are, as you enter adulthood upwards, these things can actually take anybody out, and we need to be careful to do what we can do about it. I am a medical doctor, as I said, and I have a bias or likeness for this cardiovascular area, so that's why I'm starting with it. So we started talking about hypertension the last time, so we will continue in that vein. And truly, hypertension is one of the major cardiovascular diseases, so to say. Yes, it's one of the major causes of these cardiovascular problems. There is something we call risk factors. Having described what the cardiovascular system is, there are things we call risk factors. That one is big grammar for the layman, but we are trying to say that there are things that can cause these cardiovascular diseases. Maybe let me try and describe what risk factors is. What you are used to should be this causes this causes this. So, but in medicine, we talk about risk factors. Let's imagine, malaria. Yes, most of us know malaria because I believe those in the tropics, you may have had it once or twice. It's something common with us. So malaria is the disease. We know that mosquito carries the malaria parasites, the plasmodium, and injects it into the body, and malaria will happen. So we are sure that malaria disease we have is caused by malaria parasites. So it has a definite cause. That is very clear. So there are diseases, there are problems, there are issues that don't have very definite cause. But we know that many times when this disease is there, we see that this particular thing is almost always associated with this disease. Let me give you an example.